Oh, hey, my name is Dr. Braden Gravelle, and I'm one of the residents here at the Family Medicine Center here in downtown Indianapolis. I was just talking to Karina here about why antibiotics are generally not the answer for when you have the common cold or flu. So Karina, as I was saying, the common cold or flu are generally caused by viruses, similar to what this guy looks like, and not by bacteria, similar to what this guy looks like. And that's how antibiotics work. They look at these differences and look at the outside of the bacteria to target it, and they help our bodies rid itself of the infection. However, they don't do anything against a virus. It would be like you hiring a plumber if you had a power problem or a problem with your wiring. The plumber is going to be looking for a totally different problem, and even if he does find something wrong, he's not going to have the right tools to fix it. So that's why we generally only prescribe antibiotics if we know that you have a bacterial infection.
Okay, so I heard that we have good and bad bacteria in our bodies. Do the antibiotics even know the difference between the two?
That's a great point, Karina. They actually don't. And what can happen is, as we take a course of antibiotics, it can actually lower the amount of good bacteria in our bodies. And when that happens, we can get things like diarrhea or urinary tract infections. And that can be a problem that's commonly stated after taking a course of antibiotics.
Okay, and I heard about this thing called antibiotic resistance. Is that even a real thing?
It absolutely is. And one of the problems by taking antibiotics on multiple occasions is you're basically experiencing you're allowing the bacteria in our bodies to experience the antibiotics on multiple occasions. It's kind of like putting the bacteria through a boot camp. You're allowing them time to figure out ways to become resistant to the antibiotics, and in the future, unfortunately, we won't be able to use that same antibiotic.
Oh, okay. So when I actually have a bacterial infection, I can take antibiotics then, right?
Exactly. So there's certain illnesses such as pneumonia or strep throat which warrant the use of antibiotics, and definitely you should come to see us if you have that.
Okay, so what about if I have the cold or the flu? No antibiotics then?
No, exactly. So if you have the cold or flu, the best thing to do is to stay at home and get plenty of rest, drink lots of fluids, and feel free to use any over-the-counter medications to help with your symptoms. However, if you have symptoms for longer than about 7 days, we generally want you to come in and see us. One of the things that can actually happen after a viral infection is our immune systems become lowered, and we can become at risk to actually getting a bacterial infection.
Oh, so let me see if I got this right, Dr. Gravelle. If I start feeling like I have the cold or the flu, antibiotics wouldn't really help me then because it's probably a virus. So my best bet is to stay home, get lots of rest, drink lots of fluid, but if I still feel really sick after about a week or so, then come to you because it could be a bacterial infection.
Exactly, Karina, that's exactly right.
I got it.
Do you have any other questions at all?
Nope, I'm good.
Okay, great. Well, if you guys have any other questions, please feel free to ask your family doctor at your next visit, or visit the following website, www.cdc.gov/getsmart. And as the Centers for Disease Control and Prevention state, cold or flu antibiotics won't work for you.